We have all seen the cases. An otherwise relatively healthy older person falls and begins a severe downward spiral. Apple Physical Therapy is here to help. Our fall prevention program serves two important purposes: to give people a feel for just how at risk they are for a fall, and then if there is a risk or if there has been a fall, to heal and to prevent another fall.
And now, a special presentation of Apple Physical Therapy Fall Prevention Program.
I had to sort of kind of go around the corner a little bit or something. And we were talking, and somehow I just missed a step. That's how I landed. But it was a hard landing.
Winnie Yeager considers herself very lucky not to have broken a hip in her fall. At 84, she knows the consequences can be severe, if not deadly. But these days, as she gets some real-world training on uneven surfaces, she's not as afraid of falling again. And with good reason, thanks to Apple Physical Therapy's Fall Prevention Program. The first thing to know about Apple's program is that the goal is to see fall patients in 24 to 48 hours. After that, you should know that the program is designed to provide physicians with data-driven risk assessment, whether the patient has fallen or not.
And the way that might work is whether a patient is referred over to us by a physician for an assessment. The physician says, well, you haven't had falls in the past, but I have some concerns. You may look a little bit more unsteady, but I'm not sure of a good way to assess this. Why don't you go to Apple, pop over there, have them take you through a risk screen, which we can do. It takes probably 10 to 15 minutes to do that. And then we have a form which we've developed, which we're then able to rate the patient from mild up to severe fall risk. Actually send that with the patient, have them go back to the physician, and then the physician can say, okay, I see now that you would benefit from some intervention, and then actually sign off on that, and that becomes their prescription to physical therapy. So I think for those patients who are maybe a bit more unclear as to whether they would benefit from the program or not, that's a nice tool.
Now, if a patient has suffered a fall, Apple's one-on-one care ensures a customized treatment program using state-of-the-art, evidence-based interventions at the hands of a fall prevention-trained therapist, as well as ongoing assessments proven to accurately measure progress like the Dynamic Gait Index and the Berg Balance Scale.
Berg Balance Scale, for example, is based out of 56 points, and if a patient is below 32, there's data that states that that patient is at a higher risk for falls. And so what we can do is, again, assess the beginning and the end and say, this patient went from a 26 up to a 44. That, in our mind, says clearly this patient is at a lesser risk for falls than when they came to see us.
Apple's fall prevention program puts an emphasis on the prevention piece. Yes, treatment is important, but Apple can really help the physician by taking the time to do a detailed risk analysis and an education program that deals with small details like lighting in the home, footwear choices, and identifying tripping hazards.
And so what we want to try to do here is catch those patients beforehand, or certainly after falls too, and prevent further falls, prevent the loss of quality of life that happens with patients, and then also certainly the healthcare costs that are associated with that, which I think is a key factor that all of us need to consider.
So there is an ROI with this.
That's right. That's right.
While the program's ability to provide hard data about each patient is crucial to physicians, so are the outcomes, and they're proven to be consistently very, very good.
It was a lot more than I had thought I could get out of it, because I can now step up with, when I have a curbstone, I step up to it with confidence, with purpose.
Now, if your doctor includes the word imbalance on the prescription for physical therapy or for an evaluation of your risk for a fall, our fall prevention team will go to work. With that, you're assured to be evaluated and treated by a physical therapist with advanced training in the management of balance disorders. To learn more and get started, simply go to www.applept.com and click on the Fall Prevention Program link. Thanks for watching.